Alright, Medicare Coverage 101. What does Medicare cover? So in today's training, we're going to go over original Medicare Parts A and B, Medicare Part C, Medicare Part D, sorry about that, mixed them up, Medicare Supplement, and of course things Medicare does not cover. So original Medicare Part A, hospital insurance. This insurance covers you at the hospital, obviously, and typically is premium free unless someone has not had enough work credits. So these work credits are quarterly credits, and I just tell people basically if you work in a full calendar year and make more than about $5,500 in that calendar year, 12-month rolling period when you file taxes, you would get 4 credits. And so if you think you make $5,000 a year, 10 years, you pretty much will get Part A premium free. Now for those of people who don't get Part A premium free, this is the work credit to how much they need to pay per month to get Part A. So Part A for someone who has 0 to 29 is $471 a month. For someone who has 30 to 39 credits, they pay $259. This number goes up every year, and the people who are paying this will be paying it progressively as the premium increases every year. Original Part A coverage. So when you use Part A, in 2021, there's a $1,484 deductible for each benefit period, and the benefit period is the benefit or the period in time in which someone is in the hospital continuously for a 60 to 90 day time frame. Now, if someone is discharged from the hospital and goes back in, they're still covered under the deductible period, so long, of course, as the hospital bills correctly. Remember that when they get in the hospital, they pay a one-time deductible, and their benefit period begins time-wise and extends for the entire 90 days. So if the 90 days runs out before they leave the hospital, then they have a huge co-insurance per day cost of $742. Now it does get a little messy if they get discharged and then they come back and they start up a new benefit period, but the benefit period typically lasts for 90 days, and they break it up by those quarters, 90-day quarter or 90-day increments. Most times I tell folks not to worry about it because most people don't stick with original Medicare Part A. They either get a Medicare Advantage plan or they get a Medicare Supplement plan, which tends to make this conversation a lot simpler. But just so that you folks all know who are listening, the hospital inpatient stay, the problems with it is that it is a very large one-time deductible, $1,484, and also the cost burden if you were to be one of the very few people who would end up needing hospital care for more than 3 months. That amount per day is $742, and you have 60 of those co-insurance days in your lifetime. If you use up those, anything after day 90 is 100% burden on the Medicare beneficiary. Again, the benefits of Part A insurance is it's definitely really good insurance. I mean, hospital stays can be in the millions of dollars range, but as you can see here, it's quite lower than that. The problem is though is that that's still expensive, and you never know how much this could be, especially if you're in a hospital for long periods of time. So that's one of the problems with original Medicare, right? It is uncapped. Original Medicare also covers hospice care, and it's a zero copay for hospice care. That's only for hospice at home. Medicare covers hospice services, but not the hospice room or board. If you go to a private facility where you get hospice care, like a nursing home, Medicare doesn't cover that. They don't cover the room or the board. Also, during hospice care, you may have to pay co-payments for drugs, even if you're in home. And that's where you need to see if Part D coverage will pay for it, and sometimes Part B, as in boy coverage, may pay for it during those times. So again, it's a 0% or $0 copay for home healthcare services, and if you need any equipment, that's Part B. Part B covers durable medical equipment services, and you'd be responsible for 20% of that, or the client would be, because it's going to be billed under Part B instead of A. Part A also covers mental health inpatient stay, which is similar, or it's pretty much the same as the regular hospital payment, but it is a different benefit and a different benefit period. So therefore, you would incur a new deductible period, and of course the lifetime days are different for mental health hospital and for the regular hospital insurance. Also keep in mind that while you're in the hospital, if you are seen by doctors who are not hospitalists but regular physicians, they will bill under Part B, and you can be charged for both Part A and Part B services during the same hospital stay. Another part of Part A is the skilled nursing facility stay. And the nursing facility stay has a $0 payment, or $0 for days 1 through 20. Typically, skilled nursing facility stays happen after you're in the hospital, and for it to be Medicare approved, you have to spend 3 nights in a hospital. If you're in 3 nights in a hospital, you automatically qualify for skilled nursing home, and then you would be paying $0, but you had to pay the upfront Part A deductible. So that's kind of how it works. Part A doesn't cover you after day 100, period, because they believe that that's a long-term care and you need a long-term care policy, or you would need to pay out of pocket to remain in the skilled nursing facility beyond that 100-day limit. Original Medicare Part B. Alright, so Original Medicare Part B premium is on a sliding scale based on income, and also it is never free unless you qualify for Medicaid or some level of state assistance. The income that Medicare uses is the tax return from 2 years ago. This Part B premium also increases annually. You will never pay more than the total cost of Part B, and you can watch one of my videos on where I go over the total cost of Part B, but it's basically 4 times the amount of the base cost of the Part B premium. So as you can see there, the normal regular Part B premium is $148.50, and it goes up for each income level that you surpass, and this amount times 4 is about $600. So you're never really going to be paying more than that, even if you make above the maximum level for the income levels. And this is called Irma, Income Related Monthly Adjustment Amount, IRMAA. Clients who are subject to this will get a letter notifying them their adjusted premium amount, and most times they're not really happy about it, but there is something you can do. You can file an appeal, and I have another video about that on how to file appeals for the Part B premium. And many times sometimes retiring can be a life-changing event. They have a whole list, and you can check out the video for more details on that. Original Medicare Part B also has a late enrollment penalty. We kind of went over that in the enrollment period video, but the penalty is for life. For each year you're on the program, you will be paying that penalty. It's 10% per 12-month period that you are eligible but did not enroll. And of course, late enrollment penalties typically only happen when you sign up during the general enrollment period. All right, how do you use, or how much does it cost when you use Part B? Part B has an annual deductible, and then you'll pay 20% of the Medicare approved charges. It's an 80-20 program where Medicare pays 80% of the bill and you pay 20% of the bill. Of course, that's after paying the deductible. And every year, the deductible does go up a little bit due to inflation. And here are the numbers for 2021. Keep in mind that Medicare has a lower negotiated payment amount than regular insurance or than the retail cost of insurance. You can think of it as wholesale for Medicare. And it will be less than what a private pay or a someone who is on the group health coverage will be paid. The doctor will be paid for. So you're paying 20% of a lesser amount than normal. So outpatient hospital service, this is something that's really, it's hard to explain because typically when we talk about hospital insurance, you pay the deductible and that covers you for all the hospital services that you're in there. The doctor visits that are hospitalists that see you when you're in there, that is covered in the Part A. Part B, however, does have a cost as well. Now, typically, it won't be more than the inpatient deductible amount. However, that's not always the case. I've seen sometimes where some people are paying almost the same amount or even more than the hospital deductible. This typically happens if someone's on a Medicare Advantage plan and they don't have the Part A deductible. They just have a Part A copayment. Newer Medicare Advantage plans do cap the per day rate for hospital insurance as the Part B outpatient hospital services cap. So for example, if one day of the hospital stay is $450, then they will cap the outpatient services in the ER or as the outpatient services like surgery at $450. But that is relatively a new thing, and just be aware that this hospital services can add up to quite a bit, especially if someone is getting Part B services in the emergency room. Alright, so Part D. Part D has a premium as well. It's just like Part B as in boy. You have to pay for these services. Part D also has a income-related monthly adjustment amount. And also, it has a penalty. And the penalty for Part D is 1% per month that someone's not enrolled and should have been. The Part D penalty is based on the Part D national average. And the Part D national average for 2021 is $33.06 per month. Now, this amount can go up or down depending on the Part D national expenditures. And of course, the Part D Irma, which is listed here, is a flat rate that is adjusted every year for inflation. Part D, when you use it. So Part D is one of those where all plans follow a basic 4-step coverage process, but each of these plans, private plans that clients need to sign up for, they can change the way that these individual steps, how much they cover and what drugs are in each tier, which also changes the structure of how your client will be paying. So this is probably the most, data-driven analysis that you can provide for someone, because they're taking the same medications. The only difference is the plan and the pharmacy, of course. So Part D, it begins with a deductible that's $445 for 2021. They have an initial coverage stage where the plan and the member pays a part of it, and the plan and the member, if the costs exceed $4,130, then they move into the coverage gap, or the donut hole as many people call it. And that's where the member pays 25%, the plan pays 5%, and the pharmacy actually discounts 70% of the cost. In the coverage gap, beneficiaries will pay 25% of the total drug cost, and only about 12% of the beneficiaries who are on Medicare reach this, which is kind of high. It's 1 out of 8 people. So more than likely you have clients, or we all have clients that enter the coverage gap. Fortunately, the coverage gap is sometimes better than the coverage they're getting on the plan itself. Sometimes companies will have tier 3 brand medications as being a 40 to 50% coinsurance instead of 25%, so they could actually be getting better coverage in the donut hole. But that's primarily because the pharmacy discounts, well, not the pharmacy, but the pharmaceutical company discounts 70% of the price when someone reaches a step 3. Step 4 is the catastrophic phase. So that's when you, the member, pays $6,500, and of course they add in the pharmacy discounts as well. So it does help a lot in this phase by having this pharmacy discount or pharmaceutical company discount being added to the beneficiary. Now this is again in the weeds. Many of the program that I use to determine how much someone will be paying for a full 12 months with their current medication list will actually calculate all of this for you, so you don't have to get into the weeds with it. But just know that even though they're only paying 25%, they are getting a lot of help to reach this $6,500 mark by the pharmaceutical company discounts. 4% of Medicare beneficiaries reach the catastrophic coverage phase, and that's where they're going to be paying about 5%. So the two major problems of Part D, the first one is the coverage limitations. So Part D drug plans are administered by private companies, and private companies will implement cost-saving strategies like prior authorization, where the company needs to approve a drug before they will allow you to take it. Step therapy, where typically a cheaper medication will be offered before the more expensive one's offered, and your doctor will have to provide adequate notes as to why you need to take the more expensive one, or the side effects that you receive on the less expensive one, so that they can justify you getting the more expensive one. Also, there's only 2 drugs per category and class of treatment, so it could happen where the drug that your client needs is not on the formulary, and they may have to switch to another medication that treats the same symptom. And the drug formulary, which is all the drugs that the company covers, can change at any time of the year. The other category of problems that Part D has is the cost. Sometimes using insurance can actually cost more than the drug actually costs the pharmacy itself. In Hawaii, it is illegal for a pharmacy representative to actually allow or to tell the client outright that it's cheaper. The client has to ask if it's cheaper to not use insurance. Another problem is that most people who are coming off of a group plan are not comfortable. They're unaware that medication costs more than $10, and it can cost way more than $10 if you're on the Medicare program. The monthly cost of medication, I have a lot of clients who pay more than $100 a month in pharmacy cost. That's just the cost of their medications per month when they pick it up. It's uncapped, so even if we have the deductible and the catastrophic coverage being when you pay more than $6,550, you're still paying 5% of the drug costs after that. So the drug costs are uncapped, period. Some medication can cost over $500 a pill, even if it's only 5% coinsurance in the catastrophic phase. And we'll move on to that in a little bit. Okay, so Medicare Advantage plans, Part C. Part C Medicare Advantage plans are very attractive because it's what people are used to. It's managed by private plans, just like their group plan. It's all in one. Usually has the drug plan included, Part A and B services all included. They can include things like gym memberships, dental, vision, hearing, transportation benefits. Sometimes they can add like grocery, free grocery card or free over-the-counter ordering catalog benefits. And how Medicare describes it is Medicare Advantage plans are all-in-one alternative to original Medicare. They're offered by private companies approved by Medicare. So here's the funny part. So if you join a Medicare Advantage plan, you still have Medicare, which is true. Obviously, it's from the Medicare.gov website. However, you do not get Medicare Part A and B network and authorization privileges. Medicare Part A and B have very slim to none network requirements, and also have a very short list of prior authorizations. So while yes, the services are said to be the same, in my opinion it is similar, but definitely not the same as the coverage that you have on Part A and B. So here's something that a lot of people don't know. We'll first go over the cons of Medicare Advantage. So now, instead of having Medicare's rules, you have the plan's rules. The plan meaning the private insurance company. Your out-of-pocket costs could be higher than original Medicare due to network and service restrictions. So sometimes you will have to pay for a service that you want that you would have been covered under original Medicare Part B, but your plan, the insurance company, does not believe that you require them. So you could be paying for all of those services. You give up the original Medicare network, and many of these Part C plans waste resources. So instead of having the federal government manage the plans in one central location, they are subcontracting out the plans, which then have administrative and overhead costs like the building, like marketing, and staffing. So it can be more than the base cost that original Medicare, the program itself, has to burden. And that's because Medicare pays a fixed amount for your care each month to the companies offering Medicare Advantage plans, which give them a cap to the amount of money that they have to spend for your services, which can be looked at as a very negative thing, because if the company only has, let's say, $10,000 to help you and they need to make 30% of that in profit in order to keep the company running, Medicare paid $10,000 for you, but you only get to see $7,000. So that's why it's very important to understand how these plans are being paid, so that you can give your client the best guidance. The two major problems of Part C: prior authorizations, step therapy, just like in Part D. Network can change during the plan year. Most plans have to approve services for coverage to apply. Plans can delay service approvals, therefore making it difficult to get care. 8% of all claims experience denials, and 75% of those denied claims are overturned, which means basically 3 out of 4 of those denied claims were not supposed to be denied in the first place. The cost to run Medicare Part C is an additional 17 to 20% on the Medicare program, and there is no conclusive data that shows that these Medicare Advantage plans actually provide any benefit at all. So Medicare Supplement or Medigap plans, they help fill the gaps in original Medicare, and it's sold by private companies. And this gap that they're talking about only pertains to co-payments, co-insurances, and deductibles. This doesn't cover any of the coverage gaps, meaning that if Medicare doesn't cover dental, vision, hearing, for example, a Medicare supplement plan will also not cover dental, vision, and hearing. If original Medicare doesn't cover a certain service, then the Medicare supplement plan will also not cover that same service. The Medicare supplement plans simply pay the financial difference between what you need to pay and what Medicare pays. These are the things to know about a Medigap plan. You have to have Part A and B. Medigap and Medicare Advantage are not the same. You pay the private company a monthly premium for your Medigap policy. You will also have to pay your Part B and Part D premiums if you have a Part D plan. Medigap only covers one person. So if your client and the client's spouse needs to be covered under Medicare, they both need to purchase one. Any standardized, you can buy any Medigap policy from any insurance company that's licensed in your state to sell one. So that's goes without saying. They have to be in the state that you live in order to buy one. Even though they're federally standardized, you cannot buy or you cannot sell a Medigap policy in California to someone in Hawaii, even though they're federally standardized plans. Medigap policies are guaranteed renewable so long as the member client pays the premium. There are some Medigap policies that were bundled to sell drugs included in them that ended in 2006. But if you buy a Medigap plan and a Medicare drug plan with the same company, you have to make two separate premium payments. This is probably not going to be applicable to many of you, but if you do run into somebody that has one of these older plans that have prescription drugs, make sure that there's number one still on it, because sometimes people don't realize that they've left that plan a long time ago. But also make sure that they're paying for what they're paying for, because sometimes the premium can be split up into two separate billings, and that was just due to what happened to the plans and having to split them up in 2006. If you run into somebody with a Medicare Advantage plan, you must make sure they are disenrolling from their Medicare Advantage plan before you sell them a Medigap plan. And that's simply because it's illegal for anyone to sell a Medigap plan to someone that has Medicare Advantage. And of course, if the person's intent is to switch to original Medicare, either by purchasing a Part D plan or by disenrolling in a Medicare Advantage plan, you have to make sure that happens, or you could be facing, criminal charges. Medigap and travel. So Medigap has a travel benefit. It's up to $50,000 per lifetime. And it is a 80-20 plan for medically necessary emergency care after a $250 deductible. And this is unique because Medicare itself does not cover anything overseas, period. So the pros and cons of a Medigap plan. The pros are original Medicare network rules apply. There's very predictable out-of-pocket expenses for Parts A and B services. It's perfect for travelers and those who want to have comprehensive medical insurance. Those who end up having any kind of expensive medical procedure will love these, because there's no worry about getting something approved typically. And after they've met the $203 Part B annual deductible, there's pretty much no cost. Part or Plan N, G, and F, that is the case. Medicare also provides what's called an MSN, a Medicare Summary Notice. And what that does is it tells exactly how much the service costs, exactly how much Medicare paid the provider or for the hospital, and exactly how much the beneficiary could be charged. For those people who have a Medigap plan, they'll see how much the Medigap plan paid for them. Most Medicare Advantage companies will not give such detailed explanations where benefits are provided. So what that means is that it's less transparent, or it's more transparent on a Medicare supplement plan. So the cons. Costs can be perceived as really high because a Medicare supplement plan could be over $200 a month. When compared to a $0 per month Medicare Advantage plan that includes drugs, it can be perceived as a very expensive item. And as with most insurance, the realized cost of most beneficiaries who buy Medicare supplement plans will be less than the premium that they pay. And some people dislike the fact that they're paying more for insurance and they're not using it. On a Medigap plan, we still have the Part D problem. All the Part D problems still exist because Medigap policies only cover Part A and B services. Premiums can go up 2 times per year, and that's an age-related increase and a utilization-related increase. So if the plan experiences high utilization from its members, the plan will increase. And of course, the cost of medical care increases every year. That is one thing, and as we age, the cost does increase. So that's why there's 2 potential premium increases every year. And you can only choose an insurance company and a plan letter once during your OEP or when you get a guarantee issue. That's the only time typically people can get a plan and choose an insurance company to work with, unless you are able to change due to underwriting or to another guarantee issue, right? Like if the company you're with now bankrupts. So, problems with Medicare. Medicare itself, parts A, B, C, and D, have similar problems, and that is that brand name medications can be very expensive under Part D. Chronic heart conditions and diabetes medication can be $400 per month per drug without any generic alternative. Rheumatoid arthritis, multiple sclerosis, hepatitis C, and cancer specialty medications can cost between $2,500 to up to $15,000 per year in just the Part D costs alone, and that's with adequate Part D insurance. Without it, it could be in the hundreds of thousands, but that's still a very expensive cost for people who are retired. There is little to no dental, vision, hearing coverage on Medicare. They treat medical infections like ear or eye infections, but any kind of dental work is not covered. And due to the nature of dental insurance, it's not very good either. Most of us are better off just saving money and using it to pay for these services out of pocket. There are, of course, exceptions to this. There are some states that offer really good dental, vision, hearing bundle insurance, and also offer very good discount programs as well. So while yes, dental insurance isn't very good, there are certain states that have really good ones. So what are some solutions? I always offer cancer insurance because cancer is the most expensive Part D medications. That's the one that can be over $15,000 if you have good Part D insurance already. And for those people who have a Medicare Advantage plan, chemotherapy is a 20% co-insurance, so they will most likely hit their maximum out of pocket. So I will combine the maximum out of pocket responsibility with the $15,000 cost for the Part D medications. And say to be fully covered, you might want to purchase about $20,000 of cancer insurance. For those who are less likely to buy that much insurance, I say, hey, well, $10,000 plan may be good enough for someone just to cover part of the burden. That's typically what I do. For dental, vision, hearing, if they have a medical condition that requires them to get more than 2 cleanings a year, there are some plans that cover that, and also some plans cover LASIK. And like I said, there's a dental, vision, hearing plan that allows you to go anywhere and get reimbursed for having the plan and getting dental services. So that's also a option. All right, please let me know what you want when it comes to Medicare. You can email me, call me, text me. Email is probably the best way, so I can keep a living, dynamic database on what you guys want to learn. And I'll see you in the next video.